Hi, I'm Madeline, admission specialist here at Peaks Recovery Center, and we're going to go over some terms that you should know for your first call with a treatment provider. Ethical billing practices really boils down to transparency. Are we having transparent conversations with the family? Are we being as honest as we can about what's going on? And any program you want to look into, are they willing to talk about the details of the financial arrangement? So a clinical curriculum would be the content I can expect to cover during my treatment episode, okay? And it's so important to ask what that curriculum entails. Is it just random groups? Is it a process that we've put time into? Is it mindful, intentional? That matters. You can look at this as the foundation versus the icing on the cake. The foundation, the clinical curriculum, we want evidence-based practices there, versus the icing on the cake, the enrichment, we love the ancillary stuff. AccuDetox, yoga, you name it. It's good, but we don't want to see that intersect with the clinical fundamental piece of the program. So it's important to ask if the center that you're looking at has a curriculum. Are they just random groups, or is it something that's been designed with intention to optimize results? If a program is offering a clinical curriculum that's telling us that your loved one's time is valuable and their treatment episode is valuable, and a lot of thought and effort has been put into that to maximize the outcomes. So although it's not required, it's important to have a psychiatrist. If you're going to be implementing pharmacological interventions for clients, it's important to have somebody that can oversee that through the entire treatment episode. So another term you'd want to know is, what is an LPC? And this is a licensed professional counselor. This is someone that's qualified to be rendering clinical services, versus maybe a BHT, a behavioral health technician, that's working in the field but doesn't have a clinical background. Another term you're going to hear is client to professional ratio, and this is important because it speaks to how much access your loved one has to someone qualified to help at any given moment. So an example of this would be that we have our doctor, psychiatrist, and then several PAs working with 24 men at our men's program. It could look like 100 men working with the same amount of medical professionals, and that's important because it speaks to quality of care. Substance use, mental health, this doesn't happen in a vacuum. So a family program would be running alongside a client's clinical curriculum, providing services and assistance to families. This is going to be providing some of the psychoeducational pieces, some of the support, and also dealing with a little bit of the trauma when a loved one is struggling with some of these things. So similar to the clinical curriculum that your loved one is participating in, the family program is there to offer education, support, and a sense of community with the other families. Just like you're investigating if a program's a good fit, it's important for the program to investigate if your loved one is a good fit. And that's where screenings come into play. This is going to evaluate any specific needs that the client might have and get a feel, is this the right program for them? We want an idea of what the client's needs are before they get to the door. Nutritionally, medically, psychosocially, we want all that information before they even arrive. We're moving away from this term dual diagnosis, and we want our approach to be integrative. And what does that mean? It means that we have a deep understanding of someone's culture, their medical history, their family situation, and that all departments, whether it's clinical, medical, housing, case management, they're all communicating seamlessly around this person's care. Thanks for joining us today. Give us a call, check out our website, peaksrecovery.com, and remember, treat yourself today like someone you're trying to help.